With these three talks, we move to our panel discussions. The first panel discussion for the day will be moderated by a remarkably young and a dynamic woman, Dr. Aparna Jairam. She's the founder of the Aparna Path Lab, Mumbai, and she's a very integral part of the Consortium of Accredited Healthcare Organization, a GC member, and she has 21 years of experience in quality in healthcare. So over to you, Dr. Aparna, to run this very interesting panel. We are all very ready to listen to you and your panel discussion, accreditation, and end user perspective.
So thank you very much for your kind words, and very, very good afternoon, and congratulations for having such a wonderful webinar plan. Uh, we have panelists which are, from the best. It's like chosen the pearls from the best of the industry, from the hospital, from the lab, from infectious disease, from the quality perspective, and also from the critical care. So I think we will have a wonderful discussion. But before that, I would definitely like to thank our KAHO Central, that is Vijay Agarwal sir, Lalu madam, Shankar Sen, and Dr. Anuradha and Suvin for giving me this wonderful opportunity. Uh, Without any further ado, I would definitely like to start the topic of accreditation, empowering tomorrow and shaping the future, which is the theme. As we are looking at many challenges today, be it skilled labor, be it inflation coming up, or consumer demands which are changing, behavior is changing, healthcare is also evolving. With quality in mind and satisfying the patient, which is the center of all what we are doing today in Kaho, and also we are doing in our private or whichever workspace where we are working. So when we are looking at that, as technology is coming up, newer technologies or newer applications are getting newer challenges. So I think what is happening day by day, I think as we heard Dr. Girdhar Gani and Dr. Thomas, accreditation when it started and what it is today, it's become the need, and it is empowering both the clinicians, the laboratory, the hospitals, and even the patients. So we are definitely looking at shaping a better future. So without further ado, I would like to introduce our panelists. So we have our panelist, which is starting with Dr. Naveen Chitkara. I think he's our own, and everybody knows him in Kaho. Naveen Chitkara is basically, he's from the clinical side with his field of interest being minimally invasive brain and spine surgery and neuro intervention. We have Dr. Suvin Shetty, our own from the lab medicine, who is basically the vice chair for quality professional groups. He's also head and lab head for LH Hiranandani Hospital, Mumbai. We have Dr. Arindam Kaur, who is the additional director. It is Reliance Hospital, Mumbai. Dr. Anup Warrier, who is a senior consultant and HOD of infectious disease at Aster Medicity. We have Mr. Gaurav, who is basically group head of quality and operations with Apollo Group of Hospitals. So welcome everybody. Let me begin with Suvin, Dr. Suvin. My first question to you, I mean, let's begin with the diagnostics, is when we are looking at accreditation, definitely we are looking at healthcare industry at the whole, be it a hospital or a standalone lab. So how are we actually catering to the needs and demands of this particular generation in providing affordable and, convenient care options? Because you see the costs are increasing, competition is increasing. So how are we from the laboratory perspective? Then we will come to, our different field experts. What is your take on that?
I think if you talk in terms of vis-a-vis accreditation and the cost implication, I mean, and the market per se. Accreditation has definitely helped us in improving our market because in the sense that there's a differentiation that's happening. If you say it's a market differentiation that happens when it comes in terms of a accredited entity or non-accredited entity. So definitely from the market or the business perspective, it definitely helps. Also, if you look at accreditation, it improves the confidence, the credibility of a lab services vis-a-vis improving the trust that the patient may have for the particular laboratory. I mean, it definitely plays a role. Also, most importantly, I'll not get into further details, but most importantly would be about the staff morale and the competency that improves, that gets along with the accreditation process. It's a learning process at the end of the day. So definitely all this does matter and help in building as well as improving the brand of the particular setup in the community that it provides for. Thank you.
I think very well said from the lab perspective. Everything as we see is basically has to be financially viable. So I remember those days when we actually started doing this way back in 2000, and people were like, oh my god, accreditation is expensive, why should we do that? The patient who is coming is going to come to us either ways. So when we look at that after almost 24 years actively working into this, Dr. Naveen, I would like to have your say on this in the terms of so-called as financial aspect, apart from the positive impact of accreditation.
Thanks, Dr. Jairam, and actually thanks to the CAHO organizers for giving me this opportunity. Suvin has already summarized what for lab stands true for the hospitals also. You asked me a specific question about the financial viability, how CAHO, how NABH helps us in that. See, I always say that earlier it used to be the survival of the fittest, which was important. Now, the person who adapts the fastest would be able to survive better. And for better adaptation, what is the requirement of the day that you have to understand? So it is the survival strategy which is required. If you see the trend of changing practice in different hospitals during all these years, we would realize that the costs are increasing. Cost both in terms of providing treatment to the patients and cost in terms of maintaining the infrastructure and cost in terms of our HR expenses that we do in the hospitals. Vis-a-vis the top line, which is by the aggregation of the collection from the patients, is not increasing that proportionately for reasons that we cannot actually do a jump rise in the charges that we are taking from the patients. One, and second, there are so many schemes, government panels, so many hospitals are dependent upon payments from the government panels, and these have not increased in the last couple of years. And newer empanelments have been there, like Ayushman, where the rates have actually decreased, and these are very mega. So it is a survival strategy where you cannot increase the top line and the expenditures are increasing. So coming back to the question, we will be able to survive only if we know how to increase the top line and how to contain your expenditures. And you cannot analyze this answer till the time you have got certain amount of data. And this data usually would not be there. And NABH is one thing which tells us that everything revolves around data. You cannot analyze any parameter of your hospital, your working, your function, till the time you have got data which is being generated in the hospital. So NABH helps getting us data, and it is for the hospitals to use that data to evaluate and to know how and where they are placed, because using this data, they need to know how to be more lean in managing the hospitals. And this data tells us how to improve the top line by knowing what are the areas from where the business are coming, what are the resources, how are the sources, how we can increase the business. So both of these things can come only if we are analyzing the data, which comes very easily if we have one NABH.
I think very well. I think survival of the fastest. That's the yes.
So it is the who adapts the fastest.
Yes, absolutely. I think the best person who can now add amongst us, all of us, is also Dr. Gaurav, Mr. Gaurav. If you can tell, because you are looking at that 24/7 per se. So, what do you think is definitely the positive impact apart from what Dr. Suvin said? It really, I think, matters, and I have seen it happening, building up the staff morale. I think that's a very, very huge thing to achieve because there is low attrition rate. That's what we have seen. So you have any other take on that?
So thank you so much, Dr. Aparna, for that question. First of all, thank you, Kaho, for having me here. And I think I should thank NABH for, for starting the revolution, the healthcare larger revolution in terms of quality. And because of that, we are actually talking about accreditation in India today. So thank you for everybody from scratch, from conceptualizing to where we are today and who have contributed to that. I think if we are looking at largely on the accreditation impact and end users, probably we may have to look at it at all the 5 different levels. The first beneficiary, the single most beneficiary would largely be patients, obviously. The second would be the government and the country. 4 would be the staff, and obviously the 5th one would be the board of directors or the leadership of that particular organization. And accreditation has definitely impacted each of these categories that we are talking about. Whether it's about improved clinical outcomes, safety, reduction of errors at a patient's level, whether it is about a better and improved collaboration and communication with the families, whether it is taking quality and healthcare organizations to the next level in terms of improving our name, our position, how we are positioned in the world as a country. I think that has really helped and improved so much. From a staff perspective, yes, it has really improved to reduce the turnover, but I think it has also made staff smarter than before, more aware than before, because they know that, these are the things that they need to learn. Something as simple as making sure that, as per one of the standards, that your staff needs to undergo resuscitative trainings, something which could sound very simple, but people are now aware of it. And this has actually saved lives, not only within the hospital, but even in public areas, because we come across so many examples that, there was a hospital staff in a bus or in a train, and that person actually resuscitated a patient, probably in that kind of a scenario. And obviously at the board and the leadership level in improving the efficiencies, so one of the studies which was done, which took a retrospective study, which tracked about 748 hospitals over 10 years, that reported that there was a significant net impact of hospital accreditation on improving the mean efficiency of the outcomes and efficiency of those hospitals. So I think it has definitely made a larger impact across different domains. Thank you.
Yeah, that's a 360-degree view. Thank you so much. Coming to Dr. Arindam and Dr. Anup, I would like to have your views on 2 things combined, because I think we heard about the positive impact of accreditation from our experts. You have been in different institutes and also different specialities. So what are number one combined thing about positive impact, if you can give us, along with what are the challenges which you are seeing when a particular institute is NABH, and then the next audit or the next audit, retaining the staff or adding on more facilities. So what is your take on that? Dr. Arindam, maybe you can start and then we can have Dr. Anup answering.
Yeah, I think most of the positive points were very ably highlighted by our previous panelists. We, as a clinician, both of us, me, Dr. Anup, we were obviously initially hesitant, but later on we understood that it has streamlined, systematized the process. We have much more uniformity in different institutes about on the accredited institute. Initially, the cost was always a deterrent. We thought that it would increase the cost, but later on, we realized that it is rather cost optimization due to the accreditation process and others. Two, three things also, as Mr. Gaurav highlighted, that not only it improves the performance, it also gives us a platform for evaluation, reduction of errors itself, and all we have a lot more aware staff in every category, be it bottom of the pyramid to everywhere. And also, I think accreditation made us improve our communications, which were a challenge in some decades ago. And we are now more aware to go back to our patients and their families, get their feedback, talk to them, and mend our ways in according to their feedback itself. Regarding challenge, madam, I would say two things we should really consider. One is that the accreditation should be taught in our certain courses, maybe UG or PG and all others. We were as a clinicians, we didn't know what sort of the quality processes are on. We had to learn it in a hard way, and that too in a ripe age, right? So that was a difficulty. If we can include, we start a process from Kaho and include certain things. And me being now presently I'm the secretary for Indian Society of Critical Care Medicine, and we have just started in last 3 years to include certain segment of evaluation of quality processes and accreditation in our exit examination process. So that actually helped that people, clinician took notice, because what happens in an accreditation process, there is always a sort of what would I say, non-uniformity. Some people are running for accreditation process and all others, and many of the particularly the clinical people, are completely unaware or non-interested about the process. So I think these two areas that earlier, which are interlinked, that earlier exposure of the clinicians into quality process and accreditation process, and also to include them somewhere or other, where we have formed a lot of groups that we can involve the clinicians into the quality process.
Dr. Anup, would you like to comment?
So my perspective is predominantly from the infection control part of it. So first thing is that I think NAVH and accreditation provided a lot of jobs for infection control professionals and infection control nurses. Before that, there was no infection control nurses or professionals, microbiologists, etc., getting a position or getting a role and responsibility as an infection prevention professional, infection prevention staff. So that apart, one of the many positives which we see, one is that there has been a trust on some terms of major infrastructural requirements which are a matter of patient safety, starting from say HEPA filter for OTs or RO plants for water quality. So these are some things which before this NABH and all, nobody used to spend any money on. Right? They used to have window ACs and just operate neurosurgeries with that. So a lot of focus on this infrastructure which makes an impact on patient safety came with this NABH and NABH standards. The second point which I note is that the accreditation has provided a framework for the infection control practitioners and the other staff who work in the hospital to actually set up programs, infection prevention programs or patient safety programs. How do you set it up? How do you monitor? What kind of monitoring should happen next? That is important, because otherwise people will be just doing haphazard things here and there without having a very structured way. Now, NABH has laid a framework, a structure on this is the way, this is the things which has to be captured, this is the monitoring system. So which obviously takes you along to this journey of quality. The last is that because of these cycles, repeated cycles, and the expectation of stepping up on the ladder, it provides an impetus for this continuous quality improvement, which end of the day, that is the goal for all of us. So this repeated cycles push us along to have a plan in place for continuous quality improvement, which finally, leads to somewhere better than where we were before. Right. So that is the three things which I have noted down in terms of benefits or support from the accreditation. In terms of challenges, uh, again, couple of things which I have noted is that in terms of, again, what Dr. Chitkara was mentioning, what affects the bottom line. So sometimes for many of these infection control practitioners practices, on the clinical practices, a lot of consumables are insisted. That depends upon interpretation of standards, how you want to be, how do you want to be compared to the West or the global standards, etc. End of the day, it mandates multiple use of consumables, which drives the bottom line, and it sometimes becomes a problem on, okay, your spend on the infection control, because you are expected to meet certain requirements, have gone up because you need to use all these consumables sustainably now. So that is something which we can retrospect and think how to incorporate application vis-a-vis what you actually spend for that application. The other is, which all of us clinicians uniformly feel and think, is the documentation part, and even Arindam would agree. We always wonder, where is this much documentation actually necessary? Do these people, in terms of when they handle this volume, especially the nurses rather than the doctors, the kind of documentation these nurses do, and which we often, as clinicians, we feel sometimes pulls them away from bedside. And we feel that, is there a better way to capture practice, understand practice, evaluate practice, than nurses sitting down and writing down and writing down and writing down things. So that's something, again, going ahead, which we can think about when we look at improvement opportunities. And finally, a challenge is that still there are areas of ambiguity in terms of the standard interpretation and what actually people expect to see on the ground. So that's still not crystal clear. So when we have repeated cycles, we know that when different people come, what they expect to see on the ground, there is a difference based upon who comes at the time and how he interprets that a couple of words which are written in the standards. So, in certain aspects are very clear, but there are areas which still have ambiguity. Something like food safety and vaccination in a food handler. Some of them would expect 3-4 vaccinations, and some of them would expect just a hepatitis A or typhoid. So there are things of a bit of ambiguity like this, which again we can probably work upon and improve. So these are my both the positives and the challenges which we face in the infection control perspective.
Yeah, so I think very well said. Most important is we are getting the messages. Yes, the job offers, I mean, employability has really gone up in areas which were never even heard when we were doing our MD. I completely agree. As Dr. Arindam said, we have to introduce this training at all levels, not only clinicians, but also I think when we visit our pathology and biochemistry courses, I think now it has started coming up. That has to be like catch them young. It has to be there. And yes, there are gray areas, agreed. But when on behalf from CAHO, when we are doing training, retraining, we can then build up a lot of confidence and skills with our staff. As the time is running, I want to have one more question. Maybe let's hear it from Suvin and maybe Dr. Naveen if you have a take on multiple accreditations, because Suvin from the lab side and maybe Dr. Naveen sir, you can tell us about your view on this. Suvin?
Yeah. Well, as a disclaimer, I'm a lab with a single accreditation. So I'll begin with that. We had brainstorm in between, should we go for X accreditation despite having the what we call local accreditation. The idea of accreditation should be whether it improves, whether it brings value to what you're already doing, and whether it will enhance a particular value or that the lab is providing or the domain is providing. Well, we did debate. We did a cost benefit analysis, and we felt that what we are doing right now with the national accreditation is suffice for our needs. So there was no point in going beyond the accreditation. So if personally, if you ask me, yeah, we did a cost benefit analysis, and we felt that singular accreditation, especially which suffice the need of the community that we are serving, should be good. But that may be different in another setting where the community needs would be slightly different from what we possibly would be doing. Thank
Yeah,
you.
I agree with you from the lab perspective. Dr. Naveen, you have a different take on that, or
I'll give a small example just to explain this. There was a queue in front of a vending office of first class tickets. And one of the passengers, he just jumped the queue and asked for a first class boarding pass. The lady who was vending the tickets simply said, first class gentleman is a style of living and not a boarding pass. So if you understand that why are you getting accreditation done? So why, what, and how are important. So you know what is to be done, and you understand why it is to be done, and you devise a way for yourself how it is to be done. Anyway, it never says, it says that you have to start at point A and you have to reach point B. It never says you go by a business class or you buy a train. So if you do it religiously, I think one is good enough.
super.
And if you are just looking at certifications or the number of certificates attached in your room, 10 would not be sufficient.
Very
So
well
one
said,
is good.
Dr. Naveen. Anybody else wants to add? Because I completely agree. And as a most important thing is, Suvin, as Suvin said, finally, the aim is to give the patient care with the utmost, whatever you can do for that organization. So I think without taking more time, as Dr. Samina said, we would have liked to hear Dr. Gyani for a long time. This is so dear, we could have had it for another 1 hour. But I'm really glad to have this discussion. Thank you, Dr. Gaurav. It was a very practical view, and all the 5 levels noted it down. Dr. Arindam, Dr. Anup, completely agree with you. And thank you so much. And we look forward to have more sessions like this. And over to Samina. Thank you. Thank you so much. Have a great evening.
Thank you so much.
Thank you. Thank you, Dr. Aparna, and your brilliant panel. And I was just thinking that, two things about the quality, that quality will be felt and experienced long after the cost is forgotten. So we are, of course, everything, there is nothing like a free lunch, but we will have to pay for poor quality if we are not ready to invest in good quality. So that's so true. And thank you once again to all the panelists who gave their time here for this CAHO webinar.